Yes, the moment that we knew the patient is positive, we followed the guidelines that is submitted by the Ministry of Health. So what we did is we called them. They've sent a committee here of 3 members. They got the details, and they also called a doctor, a medical officer who's working with them. So they came here. It took us 5 hours during the day to go through all the logistics of what's supposed to be to handle these cases. And by late that afternoon, I phoned them. I asked them, what must I do now? Because I have to follow the guidelines. They said I must send the patient to Robert Mugabe Clinic. It came from the medical officer, and that is what I did.
Okay, because the minister claims that the government was not informed at all. Do you think he was probably misled by his officials, or what happened in this case? Because it's
I don't know, because I think the minister doesn't know what really happened, because this is what happened on ground level. We called them, we were informed by them, and they have sent the ambulance, not my ambulance. We made use of their ambulance that they've put on the guidelines that we have to use. So if they were not informed, why did they send their ambulance? Yes, we act upon what is set on the guidelines on that stage.
So what do the guidelines say in that case?
We have to send the patients to the Ministry of Health. We have to inform them, and we have to send the patients to the Ministry of Health. That is what we did on that stage. For sure, it was not the correct picture. It's not what happened during the day. We worked together. We worked together with the doctors that came here. The Ministry of Health sent 3 doctors to assess the patient. We worked together. They wrote the script that must be followed on the other side, the medical script, not my doctor. So I don't understand where this comes from, because we followed what their advice was on that stage. Exactly. So we have an isolation room when the patient, when a suspected case comes in. We don't send the patient to the hospital, into the hospital, because we also have to protect the rest of the other patients that is here. And then we have prepared, it will be ready by Friday, another ward that is totally isolated according to the guidelines, where we can admit 7 patients. On that stage, on that stage 2 weeks ago, we thought we have to, because the guidelines said the patients must go to an isolation unit at the state. So we didn't have an isolation ward on that stage. But after a meeting with the government, they made it clear that we have to prepare as well. So that is why we converted 1 ward into an isolation unit for COVID-19 patients.
Can you just explain the risk that was there if you hadn't moved the patient to follow those guidelines?
Yes, on that stage I had to keep the patient in an isolation room far away from the other patients, because that morning there was 121 patients in the hospital. So I have to protect them, not to expose them at that stage. No, there's no patients, COVID-19 patients in the hospital. So they're safe at the moment, and we are prepared. No, we went to the minister, we offered our services to the minister, all the private hospitals, and you will be surprised what we did.
So what did you do, for instance?
That is still pending.
Okay.
From Lady Pohamba Hospital, we really want to take hands with everyone in Namibia, with the public, with Ministry of Health, and also the private sector, because we're facing a crisis and we have to take hands and work together. That is what I offer. Thank you.